four, four, four,
Camera 1, stand by. Camera 2, stand by. Camera 3, stand by. Camera 4, stand by. Live at 7 o'clock, stand by. Testing one, camera two, camera three, camera four, come on. Thank you for joining us for the live broadcast. I'm your host, Roger Mirage, for COVID-19 from the University of Maine, Fort Kent. In studios with me, Glenroy Osborne, director and executive producer, Ruth Ann Lorman. We're going to take a quick break and we'll be right back. What is the camera never change? It never stop share. We never stop share.
Yeah.
But you there hear me? All right, maybe that's. It delayed by 10 seconds, you know. Thank you guys for joining me live today in Studio 318, coming to you live right here in Northern Maine. It is 48 degrees outside, partly cloudy, and we want to get into the meat of the matter, the coronavirus, the thing, today's topic that everybody is curious about, wanting to know. Before I begin, I must say that anything expressed here and the commentaries are my views, which are sourced from the World Health Organization, the Maine CDC, and other news affiliated sources. You can check the description box for those links. We're going to get started with the coronavirus. Please note, due to social distancing, I only have two persons in studios with me. So from time to time, you will see me going between the monitors and computers. I have to serve as a co-producer today between the content that is shared. So the big topic at hand is, what is the coronavirus? Everybody wants to know, how is it affecting us? How are people doing? Very quickly. So we're going to begin. And every time I share my screen, I will tell you I'm sharing my screen. And that is because the data that I'm sourcing is from the World Health Organization. And we're giving you an opportunity to read it for yourself, an opportunity for you to view it. And so my producers, okay, they're telling me that I need to start right away. So let's begin. So we're looking at the information presented by the World Health Organization. And the first thing we must answer is, what is the coronavirus? What is the coronavirus? And we're looking at it. I'm having some technical difficulty there. Sorry about that. Okay, thank you for joining us back. Sorry about that. We were having some technical difficulties. So the coronavirus, aka COVID-19, is the infectious disease discovered, the newly discovered coronavirus. So the word coronavirus really isn't new. There are several different types of coronavirus. This one specifically is COVID-19. I guess they named it from 2019. Now we're going to look at the World Health Organization. We're going to look at the facts. And we're all going to look at the preventative measures and the symptoms. So to prevent the infection, there are several things the World Health Organization is recommended to us. And that is to wash your hands regularly with soap and water, or to clean them with alcohol-based hand rub. You hear stay 6 feet apart. According to WHO, it is at least 1 meter distance between you and the people that you come into contact with. What you're trying to prevent is the sneezing, the coughing, the exchange of bodily fluids. And that is why it's also important that you cover your mouth and the nose when coughing or sneezing. Importantly, you've heard it before, stay at home. Some of my Jamaican counterparts have said tane yard, which is the Creole patois for stay at home. And different countries all around are, school is closed. A lot of persons are working from home. Only essential workers are out and about. Now, they're also telling us to refrain from smoking and any other activities that involve the lungs or weaken the lungs. The corona attacked the respiratory system, which involves the lungs. And so you want to make sure it is strong enough to fight it on its own. not everybody will be able to get a ventilator depending on where you are in the world. As we know, there's a shortage of PPE all over the world. There's a shortage of ventilators. They're also saying practice physical distancing. So while you're practicing social distancing, whereas you're not going to the movies, you're not going to church, you're not going to school, you also need to practice physical distancing because you are going to the supermarket, you may be going to the hospital depending on your job, and you may be going outside for exercise, for a jog, and you still want to maintain that physical distance from the person. We know some persons are even physical distancing within their house for news reporters and for nurses, for doctors, firemen, police, for all these first responders. They're staying at home by themselves in different rooms. We saw even where some news presenters are in their basements doing live so that they can physical distance from their rest of their family. And so these are the things that the World Health Organization is recommending to us. But for this program, we're going to focus a lot on Maine and what is happening in Maine. We're going to look at Aroostook County, and we're also going to look at it in terms of the world, what is going on over there. And I'm going to begin again sharing my screen. So when we look at Maine, one of the things we look at is the female to male percentage, the count. Now, there's no study to confirm or to prove or to deny that your gender affects how you interact with the disease. Here in Maine, we have a count of 550 females and we have 465 males. Now, this is from the Division of Disease Surveillance, as you see at the bottom, from the Maine Center of Disease Control and Prevention. This was last updated this morning at 10:30 a.m. Now, it's not something to boast about, but in terms compared to other states, Maine is doing well. And it is safe to say that there is physical distancing being practiced, there is social distancing being practiced. When we scroll down, we also look at the overall setting of Maine. We look at the table, which was also last updated this morning. So we have 39 patients that are actually in hospital in Maine. We have 19 who are critical care, and we have 7 who are on ventilators. Now, when we look at the capacity of what the Maine medical system can manage, we see that we have 162 bed available for critical care, and we also have 329 total critical care beds, but available right now is 162. We have 296 available ventilators, but a total of 315. And we have another 394 alternate ventilators. And as I said earlier, only 7 persons are on ventilators, so we're doing pretty well in terms of preparedness in Maine. We also look, it's hard for the CDC in Maine to update how many persons are being tested negative because a lot of the tests are being done in outside labs outside of the state of Maine. And so once every week they update it. Today, as of April 22nd, 16,784 persons in Maine have tested negative. And that is very commendable compared to other countries, other states. And again, this is from the Division of Disease and Control. Now, this is the important thing that we want to look at, this data right here. This actually happened 2 days ago overnight. Maine has 532 recoveries compared to 433 that are confirmed right now. So we haven't crossed the 1,000 threshold, or we just about crossed it, depending, we had 1,015, we just about crossed the threshold. But we have more recoveries than persons who have a direct disease, which is very good. And as long as we continue to maintain that social distancing and that physical distances, then we can flatten the curve right here in Maine. Unfortunately, 50 persons died here in Maine. And no death is good death. If one person died, that is bad death. And so we look back from the World Health Organization. Now, some of the things we want to talk about when we talk about the coronavirus is, how is it affecting our daily life? We know that schools are shut down. We don't know if they're going to be open September. We see in some countries there's rationing of food, there are shortenings of food. Here in the United States, fortunately, we haven't seen anything of that sort as yet. But we do understand that there are other complexities to the disease. It has changed the world as we know it. We are living in a world that many of us, we've never gone through a pandemic before. We've seen other diseases. We've seen the H1N1. We've seen CHIKV. chikungunya. We've seen the Zika virus. We've seen even polio. I don't think I was alive during polio. We have the measles outbreak, and we have all these outbreaks. But no other outbreak has ever put the world at a stop like this. It has put countries on stop. It has put cities on stop. It has even put continents on stop. But this disease has single-handedly put the world on stop. I was reading an article the other day in the New York Times, and there was an indigenous person who lived deep within the jungles of Brazil who actually died. And the Minister of Interior, I believe, and Indigenous Life they did an autopsy for some reason. The story didn't provide the full facts. But what we know is that the person died from the coronavirus. Now, we don't know what he came into contact with. We don't know how it was transmitted. The point is, it is going everywhere, and we have to prevent it. Now, they tell us now that you must wear a mask in some countries when you go outside. A lot of persons are making a mask at home, or they're ordering it online. Now, something that the World Health Organization is reminding us to do is that when we wear a mask, we want to wear the mask properly. And so when we go outside, a lot of persons tend to wear the mask below, and so the mouth is covered, but the nose is not covered. And so you want to make sure that the mask is completely covered, right? Because those are your access points where the virus will be transmitted. You also want to be careful with touching your faces, unless you just wash your face and you have a dire need to touch it. And I know it's hard, especially if you had a, how would I say, a compulsion of sorts where you always pick your finger or you scratch your eye. It is hard, but it is something for us to practice. And that is very important because the virus can be on a hard surface. You can touch it and the virus is on you, but it's not necessarily in your immune system as yet. But when you wash your hands, you've just washed away that virus. And that is why it's important that you practice social distancing, because again, you could also touch the person beside you, and then they in turn touch their hand or bring it home to their children. And so the coronavirus has created many new way of life. Scientists is saying, will we ever go back to normal? The truth is we don't know. But what we know, in our fight to survive, we have to enforce these rules and we have to live by them. We see how many first responders who even have equipment, some of them are still contracting the virus. As we see, we also heard the virus is mutating. There is no cure for the coronavirus as it is, and there is no vaccine. However, there are several clinical trials going on all over the world. There's trials going on in England, there's trials going on in the United States, there's trials even going on in Germany. And so nobody has come out as yet. And we know for a vaccine, there is a process and there is a requirement. So even if by some miracle there is a vaccine working right now, there's still that period of watch. There's still that period of analysis that we have to do to see if if it's going to change, is it going to mutate, and how does this react? It's not only testing it in one person. We have to look at the ancestry makeup, the gender, how will it affect everybody, the mother who's breastfeeding. And so it is important that we maintain social distancing, we maintain physical distancing, and that we follow the guidelines. Now, one of the next things I'm going to share on my screen right here, I'm not sure if it's already loaded on the prompter for me, is another thing I want to share right here is this is the best picture that I can share with you guys that can talk about the probability of contamination. And it is important that we look at the picture, because I understand some of us are visual learners for specific subjects. Now, where you see it's very high, not only are they not a meter or 6 feet apart, they are not wearing a mask. They are not maintaining physical distancing, and they are not maintaining social distancing. They are right there. And so the probability is extremely high. If we look at the second picture, they're not maintaining physical distancing, but one of the persons have a mask. Now, the probability is still very high, but we don't want high. You want none at all. And the probability for the other person who's not wearing the mask is definitely very high. Then we look at this third image that we see there. So the other person is now wearing the mask, and they're not wearing the mask, but there is some distance between them. And so the probability is very medium. Now, what you must understand is the person who is that virus, that image of the virus, it's showing you if the person had the virus. And so it's showing you the probability of maintaining the, okay, I'm being told by the producers that the picture is not showing. Let's see if we can get it up. It's very hard in these days, you know, to do everything on your own. You don't have the full staff in studios. Let's try that again. Are we seeing the picture? I'm waiting for my producers to give me a signal of what I'm sharing. I see we're getting some text online. Let's look at those. And so persons are saying, we're seeing the picture. Okay, so let's start over. So we're talking about the probability of the virus spreading. So if the person with the virus is not wearing the mask in the first picture, it is very high for the other person to get it. Again, if the other person is wearing the mask in the second picture, but the person with the virus is not wearing it, it's still very high. Now, if the person that is wearing the mask that has it and you're not wearing the mask, but there is some physical distances, it drops to medium. Now, if you're both wearing it, but you're not maintaining physical distancing, then it's low. But then we look at it now, when apply the 6 feet apart, it is very low. In fact, only in probably a serious sneeze or a cough, you probably would get this. But let's go to the extreme. What if you stay home and you wear your mask at home with your others, and the person outdoor, whether they're wearing their mask or not, you have no chance of getting it. Unless when you leave home, you don't wear your mask. So when you go for that little grocery run, or you go, you know, for a little drive out. And one of the things, I've been tracking this from the get-go, is that one of the, you know, domestic violence, we look at depression, we look at little children who don't understand what's going on. We know it's not easy, and they know it's not easy. But in the fight of survival, nothing is easy. We all have to make sacrifices. So if you have a nice backyard or a good little space, and you can take your child out for a quick walk, make sure that child is wearing a mask. Make sure you're wearing a mask. Make sure you're not touching anything that you don't need to touch. Make sure you're not touching your faces. Make sure you wash your hands with soap once you re-enter the house, because that is very important. We're going to take a quick commercial break, and we'll be right back in studios. I am Roger Mirage. We have some more updates for you, and we'll be right back. Thanks for joining us back with this live update. We're talking about the coronavirus, COVID-19, the implications, the symptoms, the preventative measures. And we have some very good information for you here. My producers just slipped it to my desk. And so we're going to start sharing our screen again for this information. So what I must say is that any advertisements you guys see in this shared screen, we do not support or we do not endorse. However, it is Google and we cannot stop it. So we're looking at the coronavirus cases and look at that. Let us pause and look at that. That's the amount of cases we have in the world. That's the amount of deaths we have in the world. And that's the amount of persons we have recovered. But for this program, we are going to be looking at some statistics right here. And we have 877,126 persons recovered or discharged. Unfortunately, we have 822,000 deaths cases which had an outcome. And we look, and those are the closed cases. Then when we look over the active cases, we have 1,849,534 persons, 97% in mild conditions. And when we have 57,591 persons in some critical conditions. And so we can see there looking at the statistics right here, we see that between January to March, that was a period really where the virus was just creeping in. And then between that March 7th, we saw where the cases, they soared. By April 25th, we're still going high. The same for deaths. It is correlative related. Look at that. Now, let's look at some world statistics. The United States, as we know, has crossed Spain and Italy, who in the early days were fighting this virus and it did them bad. The United States, right now, we have 986,045 cases, 25,394,000 of which are new cases. In the United States, we had 55,377 persons who died, with 1,121 persons being new deaths. Now, what is important, and I don't have a graphic to show you, but what is important based on our research is that in the areas where they're not practicing social distancing, they're not practicing physical distancing, when you look at the urban areas, the clustered areas, you see that there's a spike in cases, there's an high increase in cases around it. You look at, for example, Maine. Let's look at Maine, a perfect example. So, you know, we always refer to Northern Maine and Southern Maine, and we know that Southern Maine is more urban while Northern Maine is more rural. And when we look at the spread out of the cases in Maine, you realize that the majority of cases are around the Portland area and the Augusta area right there in Southern Maine. When you look at Northern Maine, in Aroostook County, for example, we only have 4 cases, one of which recovered. And so you look at it, and so geographics plays some role in it. Obviously, where you're going to have more people together, you're going to have more viruses, more contact, and more physical contact, but not physical distancing, because the people, they live together. And that is a sad reality. Probably going forward in the next 20 years, it's something for governments to look at. How are we building our houses? We see all of the new apartments, a lot of new complexes going up. And you know, the designs are nice, but how does those designs impact social distancing? And so we're going to take some questions from our live chat. We're going to take some questions to see questions that persons wants us to answer. Pull that up. Producers? Okay, while they sort out the live questions, we'll continue to look at the shared screen. And so, well, one thing to note is Spain and Italy is still very high up there, but they are, based on reports, they are getting, at this point, let's look. So Spain has a total of 226,629 total cases. Now, out of that, Spain has had 117,727,000 recovered, with only 85,712 active cases. Of that, 7,764 cases are seriously critical. And so the top cases is 4,847. and they've had 496 deaths, 1 mil pop. And they've done 1,001,999,548 tests. Now, it is no secret that in the early days of the virus, different governments were scampering, going all over, trying to find test kits. It was very hard, and because it was very late in coming up with test kits. And so we had a test kit, and then we had the rapid test kit that would give us the results even earlier. A lot of the hospitals, they're telling you, if you have the symptoms, don't just turn up to a hospital. Don't just turn up. Call your healthcare provider first. You relate your symptoms, because you don't want to actually have the virus and you go into the hospital, you go into the waiting room, or you go wherever, you touch all these stuff, right? And then you transfer it to other patients who are waiting there for other critical surgeries or other important surgeries. So it's important that if you feel like you have the symptoms, you want to make sure that you call your healthcare provider. Now I see my producer signaling to me, or first question in here. Oh, sorry. Okay, so the first question is coming from Jamaica. How long do I think this virus will last? The truth is, I am no scientist. I am an average university student. I do not know how long it will last. Based on reading and projections, I am hopeful that by after summer, it won't be gone. We saw the top scientists for the United States tell us that it won't be gone. But what we know is hopefully we will flatten the curve enough so that we can learn to live with the virus. I think on a personal note, we will have to learn to live with the virus because at some point we see where the president has stated that he wants to open the economy. He hasn't given us a timeline yet. He's told the governors that it's up to each state to, decide when they need to open their states. And we've even seen reports where different regional states, the Northwest, the Midwestern, they're coming together to decide as a region when and how they're going to open the states. The federal government to the president has given us guidelines. I think it's 3 phases he's given us in terms of how he thinks and how we should reopen every state. We know that Georgia has reopened. We know that, I believe it's the beach in Jacksonville, Florida, it's open, but you still have to maintain physical distancing. You still have to maintain social distancing. We saw where several states extended their period into early May. They're about May 14th. A lot of the eastern states are saying May 14th. What I said to my producer before we started, I said, it's so funny. When we first had this outbreak, it really started in the western part of the country. Like it was hitting Seattle, San Francisco, San Diego, California, Washington, all those states were really getting hit. And as soon as the cases reached the eastern, really, we saw how it just exploded in New York, for example. And one of the reasons is not that New York wasn't prepared. The truth is nobody could really prepare because to this day, we don't have the actual facts coming in from Wuhan, China, in regards to how many persons died. And so scientists are saying the models that they've created, they're changing every day because they're not working with live figures. And that's nobody's fault really from the United States or any countries because nobody has been into China as yet. Usually a team from the CDC would go in after, or World Health Organization to see who is patient one, or, we don't know who's patient one is yet and stuff like that. And so it's hard for the models, they're changing every day. But what we know for sure is that if we practice the social distancing, if we practice the physical distancing, we can maintain it. So now I'm gonna go to the big screen because we will be answering some questions. I do like this background that we're using, thanks to the producers. So the first question we're taking is, what are your views on the virus being called the Chinese virus? Very strange question, very tricky one too. I support whatever the CDC and the World Health Organization has agreed to. In retrospect, if somebody called it the Chinese virus, technically they are not wrong. If you look at it from an English standpoint, they have ownership, and so that is fine. But the virus, the correct name that we're using is COVID-19, the novel COVID-19, AKA we just say the coronavirus. I think a lot of stuff are said by different people, and everybody has the freedom of speech. It is their fundamental right here in the United States of America. They have freedom of speech. Can it be transmitted through food? Yes, it could be. Um, how? Not sure exactly what type of food you're talking about, and how. Are you talking about how it's prepared, or actually touching somebody else's food? It can be once there is surface contact, it can be transferred. So whether you're preparing the meal, you want to make sure you wash your hands. And I'm going to say this: if you can eat from your own pot during this time, do so. I understand not everybody's able to go to their bed every night with a hot meal, but if you can afford not to dine out too much, but still try to support the local businesses with their dine out, do so. It reduces your risk. We're going to take another question. How can we help stop the stigma associated with what's that last word? With COVID-19. Now, it is programs like these. It is programs that you watch on Fox News, that you watch on CNN. One thing they all have in common is that they are preaching the same thing from the World Health Organization. The words for 2020 viewers: social distancing, physical distancing. That's how you stop it. Now, the stigma, it's a very tricky one. The stigma is different everywhere. In my homeland in Jamaica, there was a case where somebody coughed on the bus and the entire bus left. People ran off the bus. And I won't say people should stop stigma. I know what it's like to be afraid. It's the fear of the unknown. Sometimes our body reacts before our mind do. And so to stop the stigma, I would say it is important that we pause, we think about everything we do in this time. If we know we're going to go outside, create a checklist. Mask, wash my hands, hand sanitizer, soap, right? And how you stop the stigma is make sure you check out the facts. When you hear something, Google it. And when I say Google it from accredited sources such as the World Health Organization, the CDC, or your local states or countries' website, response website. And the reason why I'm saying that is because, as usual, with any virus, with anything that is the trending or the phenomenon in the world, everybody wants to say something. Everybody wants to contribute about it, even when they have no facts or information about it. Because guess what? Everybody wants to be a part of it. But for your own safety, you make sure you are not discriminating or creating false sense around the virus. Another question we're going to take, any advice for college students? College students, this is my first advice I want to give you. Make sure you're doing well in your classes. I know it's hard to maintain your classes. Some of us, we go to college in person because we learn in person. Not everybody is able to maneuver the internet. Not everybody has access to the internet. However, every school has different resources. You want to make sure you're tapping into those resources. You want to make sure that you're reaching out to your resources. In the University of Maine system, we know we have the Student Success Center, we have Trio Services, we have Student Affairs. Send an email to any professional staff member. I'm going to say this, send it to everybody until somebody responds. Your education is important, because what I said to my friends is, after this virus, whether 5 years from now or 10 years, I think the world will reset and they will want your degree. I don't think nobody's going to want to hear, oh, because of Corona, I couldn't. No. The world will become the world again, and it's going to be a cutthroat world. They're going to want your degree. College students, you want to set a timetable, especially if you're working from home. You want to make sure that, okay, I get up at this time, I watch some TV. Nothing's wrong with watching some TV. You want to make sure that you study. Actually, if you're not working, see if you can do your classwork in the allotted time you would have done it if you're in school. If not, do it whenever, but make sure you do it. The second thing I want to say is don't lose hope. The minute we lose hope is the minute we lose ourselves. It's the minute we lose. You must have faith, right? You must have faith. And good luck. I'm here too, college students, 2 more weeks to go, and finals is still finals. Right after this, I have some homework to submit. So keep at it, keep going. The next question is, what do you think the coronavirus can do to help people struggling? What can the government do? Oh, sorry. So here in the United States, some of us, hopefully, would have been benefactors of the stimulus check that you would have received from the federal government, hopefully. We know for different persons, I think everybody at some point should qualify or hopefully qualify. I know it was depending on your 2019 tax returns or your 2018. I know the government is doing that. I also know that their Congress just passed some billions of dollars to help small businesses. We know that for colleges, the CARE Act, the $2 trillion was given through the CARE Act through universities to help with students, half of which must go direct to students to help them. We know, for example, the University of Maine system, they have put measures in place to help students. Different schools, like foundations for each schools have gone out, alumni have helped out. What I have seen in this coronavirus that I've never seen before, we have seen communities rally behind each other. And that, my friends, is what makes us humans. It's what separates us from others in other planets that we don't know about, if any. It's what separates us from certain animals. When we can come together as humans and recognize that we're all trying to live, we're all trying to survive. Here where I am at, I can tell you some faculty members, some staff members, they have really put measures in place, some by their personal trust, some with the school. The fact is there is support, and we hope that, you know, some of you guys will get some of those supports. So it's very, how we're seeing the questions is very hard for me. I'm gonna ask the producer to actually talk here now. Go to live to mic 2, please.
Can you address the comments by the Pope stating that the virus is a punishment from God?
Wow. So first of all, nice question. Can you address the comment by the Pope, the statement that the virus is a punishment from God? Now, very funny. I know that many of my viewers know that I am Roman Catholic. I'm a practicing Roman Catholic. And so you would want to hear my views on this. What I'll say to you is I have not seen in what context Pope Francis II has made that statement. Context is very important. And so I would not want to comment on that. From a religious perspective, we don't preach that God punishes people, at least under the New Testament. And so I would love to see the context in which the Pope made that statement. It would be very ignorant of me to comment on that without seeing it in full context. But I do appreciate the question. And that is it for our live questions. It is 7:39 p.m. right here in Northern Maine. We're gonna go to our last commercial break, and when we come back, we'll wrap things up. Thank you for joining us back right here in Studio 318, coming to you live. It is partly cloudy outside, but we're still going. We expect some rains later, some shower later. Now, we got a question that I want to address over the commercial break about essential workers, the nurses, doctors, not teachers. Well, teachers are essential. During this time, the essential workers are nurses, doctors, policemen, anybody who needs to be out there, grocery workers, the janitors. And the question, go ahead, my producer, camera 3, could you read the question?
Do you think our essential workers like nurses, doctors, hospital staff, grocery workers, etc., deserve anything from the government when we hopefully reach the better side of this pandemic?
Do I think they deserve anything from the government after this pandemic? Now, there's two answers to this question. One, the first thing is yes. Now, what do they deserve is the question. I know some persons will quickly say money. Now, one of the first things I think we must acknowledge after this pandemic is the importance of these jobs. Before this, we would have some people on a pedestal up here and we have people down here. And let's not be hypocrites. We know that's how we had it. We know that's how we think back then. I don't think that's how we should think going forward. Now, from the government, one of the things is I think anywhere in the world where those specific essential workers, if they were being underpaid, if their benefits weren't good, if their retirement weren't good, I think now is the time to have that discussion. I think now is the time for the government to acknowledge the importance of these. And not only the government, I think it's time for us as humans to acknowledge this. I think it's important for private entities and institutions to acknowledge this. I don't think the onus is fully on the government. In regards to nurses, specifically, I can tell you, nurses are always, saying they need this and they need that, and persons are always saying, why the nurses always want a raise? Why are they always doing that? The truth is, many of them are underpaid. The truth is, we don't know what they do. We see a nurse, so we just go, oh, that's a nurse, a doctor's assistant. Right now, nurses are running hospitals. We have more nurses than doctors in many hospitals, and they are running the hospitals. They're nurses, I can tell you, a family member of mine haven't gone home in 2 weeks. They're sleeping in the attending room. Why? Because we're short of medical staff. We have to also look at the fact that there are doctors and nurses who've contracted the virus. Some, unfortunately, have died. They are literally wearing the hero cape right now. So I do think it's time for the government to open some discussions. I'm not saying right away we should just give everything to them. I think it's important for us to balance the economy, to reassess our priorities as an economy. So some of the things that we used to enjoy in life where the government gives us, I won't call any names, some of those things we probably should cut back on and invest more on things that directly affect us. Any more questions, producers? Okay, we have one more. Studio camera 3, please. Thank you.
Why is the death rate higher amongst minorities?
Why is the death rate higher amongst minorities? Now, usually in cases like this is no surprise. Minorities sometimes don't have a choice. It's also higher in neighborhoods that are Black or around African Americans, specifically to America. One of the things is that poverty has no line, but it does have a border. And by that, I mean, if you are a minority and you have 3 children or more, or even 1 child, single parents, if you're from a society, not a society, from a community where unemployment was already low, and the few jobs you did was dependent on the other jobs that are not deemed essential, now you're going to want to get out more. You're going to be out. You're also going to want to be going out there trying to make that money, interacting with people. And so you're going to catch it more, and the debt rate is going to be higher. We also have to look at ignorance. A lot of the persons in the minorities, sad to say, they are not fully educated on what is going on. They're not, and some of them are choosing not to be educated on it. And education plays a part, socioeconomic plays a part, but what also plays a part is culture. Some persons will tell you, listen, it is our culture. We will not be restrained by these measures. We're going out. And so if the culture is very deep within the person, then of course they're going to want to go out. And they are the minority, sad to say. And so it's going to be a higher contract of the virus, and it's also going to be a higher mortality rate amongst them. I believe that is our last question for the night. And we're going to do a quick recap before we go right here in Studio 318, and we begin sharing our screen again. And we just want to reinforce this picture right here. I wait for my producers to tell me that the picture is in fact sharing with you, the audience, and then we'll get into it one last time. I saw 2 comments asking us to go over this picture again. They signed on in the middle of it. Are we clear? We are clear. So the probability of catching it from somebody with the virus in the first picture, of course, is very high, simply because there is no social distancing, there's no physical distancing, and there is no mask that they're wearing. There's no 6 feet apart. We look at it now where the person who doesn't have the virus is wearing a mask, but the person who has the virus is still not wearing a mask, and they're still not 6 feet apart. It remains high. Then we look at the probability of the person wearing the mask that has it, and the other person not wearing it, but there's some social physical distancing, and that becomes medium. But then we go into when both persons are wearing the mask, it becomes very low with some physical distancing. But then we look at the 6 feet apart and we look at the mask being worn by both, it is very low. And then when we look at stay at home and you wear your mask, well, I would hope there was another picture at the bottom of the person wearing the mask that has the virus at home or staying at home and you're at home, and then there's no way you could contact it. If you don't, there's just no way. Unless we've seen a case where somebody actually died by a mail, I believe it is, I wanna be corrected here. Somebody died by getting a package. Not sure who it is, but we did read something earlier in our research where somebody died by that. And so it's important. What I've been doing is any package I order, I allow it to stay in the delivery room for 3 days at least. And then when I get it, I wear gloves, I pick it up, and I make it wait 2 more days. Just by precaution, just trying to kill that virus. And so right here at the program, we're glad you tuned in. We're very grateful for you guys. We know we had some technical difficulties, but in this day and age, being a co-producer and operating these machines, it's never easy. I want to say thank you to everybody who made this possible, from the researchers to those who dealt with hair and clothes. I want to say also thanks to the producers. This event would not be possible also without Ruth and Lorman, who serve as the executive producer, and Glenroy Osborne, who serve as the director. Thank you for making this possible. And we'll see if we continue in the future. We don't know, but it would be in a different medium. I want to say thank you to you, the viewers too, who are practicing social distancing, who are practicing physical distancing. And I want to tell everybody, don't lose hope. Never lose hope. Hold on to it. If there's nothing else you can hold on to hope. Until next time, I'm Roger Mirage. Pleasant viewing.